Good morning. This is Dr. Mike, and I wanted to take just a few moments to talk to you in our last session, just to wrap up our meeting and to talk about the last 3 weeks and 6 weeks and what we've discussed about developmental psychology. I think now that maybe you've gone through the video, the lectures, and the added materials, I think maybe you can understand and see why I consider this to be such a valuable course for you, not only in your career, but in your personal life. If you're going to be a nurse, of course, you deal with all age groups every day usually, or you may be working in a pediatrics ward or some other ward of the hospital. You'll always have, wherever you work, you'll always have different age groups of people and different needs. And so it's always helpful to understand something where they are in the maturation process and what they're going through and what they're capable of and what they're not capable of. Sometimes it's interesting in dealing with children that we don't realize that their moral compass really hasn't formed until the teenage years, and you may be trying to talk to them about something that they are completely not able to understand or to grasp. And so I think it's really worthwhile to understand these different levels. That's also especially true of geriatrics. Some of you work in facilities where people with Alzheimer's and dementia live, and it's really difficult sometimes, and you think that by just saying something over and over to them that you're communicating, or maybe even, I know people that scream at patients or scream at their parents and thinking that the louder you talk, the more they'll be able to understand. And it's not a hearing problem. And so it's just really interesting to watch people, how they interact with people with different, different diseases or problems that they're dealing with. So I wanted you just to be aware, and I hope that this class has formated some awareness that in dealing with other people, they're more there than just what meets the eye and what you're seeing. So developmental psychology is something that you can determine things about your own self, what level you're at, which stage you're in, and what you can expect and what you're able to do and what you're not able to do. I think that is helpful as well. So in this past week, or this last week we're approaching, I wanted to encourage you to think back through the materials and go back and read sections that you found to be interesting, and just apply yourself to just refreshing your memory. As I said, this book is a very valuable book, and a hard copy would be a very helpful thing to have, or keeping an online copy is fine, but you may want to purchase it and have it on hand to use for your own good. I have enjoyed our time together. This is such a lot of material, and I hope you understand that we didn't even scratch the surface on the lecture part, because I wanted just more or less to whet your appetite, to bring things to your mind, so that as you read the material, it would kind of give you a double take. And repetition aids learning. The more you're exposed to something, the more likely you are to remember it in the coming days. And so I really want to be able to do that. And there's no way in 6 weeks, really no way in 18 weeks, which is where I took this course, that you could cover all these materials sufficiently. So it's a lifelong learning occupation, so that you'll be continually learning and growing and as you go forward. But I wish you the best, and I hope you'll continue your course, finish the job, get your degree, and then get to work and do some really great things to help people, because you're in the position to do that, and I'm excited that you're there. Okay, thank you so much. Hopefully to see you again in another class in the future, but if not, best wishes and smooth sailing. Thank you.